My name is Richard Peterson, and I am a general and bariatric surgeon for UT Health in San Antonio. I serve as the chief of the Bariatric and Metabolic Division within our Department of Surgery. I'm a past president of the Texas Association of Bariatric Surgery, and I've been with UT Health for 7 years, since 2011. My clinical interests include weight loss surgery, treating patients with primary surgeries, as well as revision. I also have a special interest in treating other diseases of the stomach, including reflux disease. So after the gastric bypass, in terms of complications or concerns sort of in the long term, there are concerns, and that's why it's really important that you maintain follow-up with your surgeon in the long term. And we typically like to see patients at 2 weeks, 4 weeks, 3 months, 6 months, and a year after surgery, and then we like to see you every year after that, because we're going to be very sensitive to any changes that you're having. If you're any concerns about abdominal pain or things like that, there'll be things that we consider. With respect to the bypass, you actually have concerns for potential internal hernia, which is an actual, because of scarring that happens on the inside of the abdomen, your bowels can have an obstruction. So that's something that we worry about. Ulcers, those are things that we worry about. But again, these are things that the surgeon's going to be quite in tune to. So when you come in to see us in your follow-up, we'll be able to help you along that way. So the amount of weight loss that you can expect with the Roux-en-Y Gastric bypass is about 70 to 80% of your excess weight at about 1 year. Now, the majority of weight loss most people have is at about 6 months after the surgery. But we typically look at the 12-month mark, and you can continue to lose weight up to about 18 months. So the post-surgical diet after any of the weight loss surgeries is quite similar. After the gastric bypass specifically, you'll be on a full liquid diet for 2 weeks, pre-surgery actually, and then you'll do that same diet after surgery for 2 weeks. Then we progress you from weeks 3 and 4 to a pureed type diet. And then at week 4, we're going to advance you to a regular type diet with regular healthy foods, small meals about 5 to 6 times per day. With respect to nutritional deficiencies after Roux-en-Y gastric bypass, and actually with all of the weight loss operations, what's really important is that you have to be on a supplement for the rest of your life. And it doesn't matter which of the operations you actually end up choosing, you'll need to be on a supplement for the rest of your life. And we highly recommend the bariatric specific multivitamins and supplements so that you will maintain the appropriate amount of nutrients after the surgery. The gastric bypass has been around for a long time as far as a weight loss operation, and what we've known since about 1980 is that there are some improvements in type 2 diabetes. So essentially, after having the surgery, which is done in a minimally invasive or laparoscopic type procedure, a patient who is a type 2 diabetic is going to find themselves having a much easier control of their type 2 diabetes. They'll be off their medications, typically the day after the surgery. And what we'll find is that they may stay off those medications for a long period of time. Some people do need to resume medications, whether that be oral or insulin. But in general, having surgery will definitely improve your type 2 diabetes. So if you have bad heartburn, there are a couple of options for you, but ultimately of the procedures that we're doing primarily, the gastric bypass will be the best operation for you. It's an anti-reflux operation in and of itself, and on top of that, it obviously has the benefit of having weight loss as well.